Today I would like to talk to you about lichen sclerosus. Lichen sclerosus, or for short LS, is an autoimmune condition that affects genitalia. The reason why we develop lichen sclerosus, we don't really know, but we do know some predisposing factors. People who have other autoimmune conditions, for example, type 1 diabetes or thyroid disorders, more likely to develop LS. Topical irritation, inflammation can predispose women to develop lichen sclerosus. The state of low estrogen can also affect development of LS. Premenarcheal girls who haven't had their first period yet, and postmenopausal women who stop having their period, tend to frequently develop LS. The typical symptoms of lichen sclerosus is itchiness, discomfort, burning in the vulvar area. There could be some color changes to the skin. Skin becomes pale and white, and those changes sometimes described as a cigarette paper skin. So basically what happens to the skin is chronic underlying inflammation, irritation that turns into this atrophic tissue. There are also local changes that are happening. For example, labia minora might be flushed with labia majora. There is also changes to the clitoris. Clitoral hood might start get adhered to the gland of clitoris or completely obliterate the gland of clitoris. If you're not going to treat, the changes will continue to happen, and at some point it can affect genital area so much that you can't really have penetrative vaginal intercourse or experience orgasm. And what's interesting, the severity of the symptoms do not always correlate to the changes in the genital area. Some women might have a lot of symptoms and be very bothered and have very minor skin changes, and some women might have zero symptoms but totally changed architecture of their genital region. Why it's important to diagnose this condition and treat this condition? Well, couple of reasons. Some women might notice changes in the sexual function, like difficult to get aroused or difficult to experience orgasm, or orgasm doesn't last as long. And another important reason, about 3% of women might develop vulvar cancer from lichen sclerosus. So how can you diagnose lichen sclerosus? It's a combination of symptoms, exam, and the very important component is biopsy. Doing biopsy is very important because that will reliably prove that the changes that you experience is due to lichen sclerosus and not due to other skin conditions. The procedure done in the office under local anesthesia and takes about 5 to 10 minutes to perform. Doctor will take a small piece of the affected skin and not affected skin, kind of on the border, and send it to the pathologist to look under microscope. The amount of tissue that's taken for the biopsy is small, but we do need to ensure that we take an adequate amount so pathologist able to diagnose the condition. Before going into the treatment strategies, it's very important to mention that lichen sclerosus is a condition that you can't really cure, but you can manage. It's very common to have a flare-ups and remissions. So when you have a flare-ups, you will be getting a treatment more frequently. The main treatment modality is high-potency steroids. When you're in flare, you will be using it daily. And when you're in remission, you usually use it as a maintenance 2-3 times a week. There is no set guidelines on how often to use the steroids when you're in flare or like for the remission, but usually every specialist has their own recommendations on the frequency of using medication. What's important to know is the way how you apply the steroids, because the main idea that you want to get those steroids in the deeper layers of the skin. And the best way to do it is after your skin being soaked in a bathtub or a shower. So the skin very soft and very absorbent of the steroid. So after you're done with your shower bath, you pad your skin dry. And I recommend my patient to set up the timer and massage the steroids in for about 1 to 2 minutes to make sure that you get all those steroids in the deeper layers of the skin. And it's usually applied the external skin. Lichen sclerosus does not affect the vagina. So you do not apply steroids inside of the vagina. And if you have a concern about it, make sure that you and your doctor look in the mirror together and doctor exactly points the area where you should apply your steroids. Some of the common affected areas are labia majora, perineal area, and the area of the clitoris. Prolonged use of steroid might cause a thinning of the skin and irritation. In those cases, it's actually helpful to use the compounding estrogen and testosterone cream that helps to maintain integrity of the skin. There is also another type of medication from the class of immunosuppressants like tacrolimus that might be used if steroids doesn't work for you. There are also some additional strategies that can be used to improve the outcome of your treatment. For example, laser treatment. And the reason being that laser create those micro injuries in the collagen level, and by doing so, it renews the tissue, but also it helps to get those steroids in the deeper layers of your skin, so to make your treatment more productive. There's also surgery that can be done, for example, removing the clitoral hood adhesions that restoring normal function of the clitoris. Some maintenance techniques, you can use Aquaphor on a daily basis that helps keeping the skin moisture inside, and you can use it as many times a day as you need to. Avoid feminine cleaning products, especially those that are scented or abrasive and have a lot of unnatural ingredients, as well as avoiding synthetic and laced underwear. Because we still don't know what exactly causing development of lichen sclerosus, there is a very important role of stress. So trying to manage your stress level using meditation and other relaxing techniques can be very helpful. Let's talk about sexual health and lichen sclerosus. It obviously can cause a lot of discomfort and pain that will trigger you not wanting to have sex or have effect on your arousal and orgasm. The first most important thing is to talk to your partner and explain to them that you have the skin condition and what it means. Because it might take you longer to achieve orgasm, it's okay to use some tools like vibrators or suction devices. Because skin is dry and very thin, make sure to use plenty of lubricants to avoid any tearing. Lichen sclerosus is a chronic condition that unfortunately we can't cure, but we can manage. So make sure you have a good provider with whom you can maintain a long-lasting relationship.